Excellent. So we're going to do ergonomics and basically how to sit properly so that you don't hurt yourself over time. Now, what are some of the things that we've been taught as people of how we're supposed to sit, what we're supposed to do, and so forth? Any ideas?
Shoulders back.
Sit up straight, shoulders back. Anything else?
Keep the curve out of your spine.
Keep the curve out of your spine. Okay,
Keep your back
definitely.
flat against the back of the chair.
Definitely. Okay, so from those, what do we think? Do we think they're good or bad?
Exhausting.
Exhausting? I would agree with the one you just said, keeping the curve out of your spine, because that's actually going to make it so your muscles have to overcompensate. So the goal of any posture is to keep those curves in your spine. Now, I will get in the spine, and we'll do like that. The curves that we're looking for from the side is to have a neck one, a mid-back one, and a low-back one. So this is your neck, this is your skull, your face would be here, and we have that curve in the neck, the mid-back, and the low-back. These curves allow you to go through life and not have any problems. But here's the problem. These curves only happen if you have a balanced brain function or neurological function. So what are the three things, or the three T's, and you guys are allowed to answer if you want this time. The three T's that cause us to not be neurologically balanced.
Thoughts.
Toxins, thoughts.
Toxins and thought. Excellent. We got repeat offenders. They know how everything's going, right? Excellent. So exactly. So if we think about this, how are these things going to affect us? Well, let's think about trauma. Do you think sitting in a slouched position for a long period of time would be traumatic to your body?
Yes.
100%, right?
Yeah.
So that's actually a micro trauma that just keeps going over and over time. So if we sit in that position going forward, we actually take that lumbar curve out of our back. So we're sitting, and we're supposed to be sitting erect. That's why the best thing to sit on, if you can do it, if your muscles are strong enough, is actually one of those balls. If you can do it though. And here's the thing, most people, their muscles are so weak, they can only sit for 15, 20 minutes, and they start slouching, they get tired, ow, it hurts, and everything. That's because you're sitting the wrong way. It's not causing you to heal. You're not staying healthy the way you should. If you can sit on one of those balls, it forces you to sit erect, and it forces you to use gravity properly. Whereas if you can't, it lets me know, we got some weak muscles going on. Now, why do those weak muscles happen? Well, obviously we don't use them, but what if we have a faulty neural pathway or faulty communication pathway because of those thoughts, traumas, and toxins? Those things will build up over time and cause us to adapt. An easy way to think of this is, say we have, you guys, which T do you guys want to do? Just give me one and I'll go with it. Thought, trauma, or toxin?
And here's
Thought?
what's one to comment.
Toxic, okay. So we'll do thought first. So, does anybody have a thought during the day that stresses them out? If you say no, I know you're lying. I know you guys are all lying. So we're stressed out. Now remember, what are the hemispheres that males and females usually dominate in? Males are usually which hemisphere of the brain? Left. And females are usually which one?
Right.
Right? So if we're stressed out emotionally, we're going to go to one of those brain styles, right? So for a female, we're going to go to right. And by going to the right, that's going to cause the right side of your brain to fire more. And your right side of your brain controls the right side of your body. So guess what muscles get strong?
Right.
The right shoulder, the right hip, and then you're going to pull to the side. And then you're going to have to balance. And then you get crooked. And this is what you see, and this is how a thought can literally cause your body to change, is because it increases the conductivity or the communication to that right side of the body. So it'll cause everything to pull up. So when you sit, you're going to be like that too. You're going to tip, and then you're going to go like that. Because it's pulling everything tight. Does that make sense, guys? So we see those high right hips, high shoulders. And if you look at it, what they taught us in school was this, is if you see a right scoliosis, it doesn't matter. It's okay, it's pathognomonic, which means we really don't know what's causing it, or not pathognomonic, idiopathic. We really don't know what's causing it, but it's okay because we see it a lot in women. That's because they're right brain dominant. Now, the other thing though is if we see a left scoliosis in anybody, we freak out. Because a left scoliosis is considered a disease. It's considered that it can actually, it's so rare that if you see a scoliosis to the left, you get really freaked out because it indicates that there's an underlying bigger issue. What we were taught is you want to start looking for neurological, bacterial, some sort of bad intervention going on that's causing your neurology not to be right. So that's why when we look at it and like, oh, it's a right scoliosis, excellent, we can help you out. But to get back to sitting, so if I'm pulling my hip up higher, my shoulder up higher, and then I sit down, my butt evens out, this is still pulling up higher, how am I gonna balance? We're gonna lean, right? And that's why you notice a lot of people when they sit there, cooking around, sitting on phone. Exactly, you're exactly listing. You're moving around just to make yourself comfortable, and that's to try to balance that brain so you can be normal in space. How the body works is there's one reflex that literally determines how you'll stand, and it's the righting reflex. And what it is it's the gaze of your eyes. Everybody has to keep the gaze of their eyes straight. If they start turning, you can't deal with the world properly, and it causes a lot of issues. So if you literally put your head sideways, see how long you can do it until your head starts going, this is not right. Notice that? And that's the right, it's called the righting reflex. So it keeps your gaze straight. So whatever your body does, you always have to keep your head straight. And you'll see people walking down the street, they'll be like this, but their head is as straight as possible they can be because they have to be able to keep themselves balanced. And you know what I'm talking about, right? You've seen these people walking crooked sideways, walking in. And that's their body's way of compensating. And it's compensating due to those problems of the neurological communication. So that's the thought. Now how about a trauma? This one's interesting because this one, there's whole chiropractic techniques based on this. And it's CBP or Pedibond. And how it works is, wherever a stimuli was grossly put into the body, like say a car accident, if you're looking to one side, you put in so much stimuli, it actually reprograms the cerebellum to believe that that's normal. And this is why we start getting problems, because we think this is normal, and then we start walking around like this, but then we gotta tip our hips and we gotta walk like this. And that's why you'll see really weird gaits in people, is they'll have a major trauma, or their head is twisted to the side, or one shoulder's higher because they're driving the car like this, or one hip is up because they're pushing their foot on the gas pedal. And it's because that trauma went in and it recalibrated the brain to believe that's what's normal. So that's going to cause a lot of issues. So all these, that's just the thought and the trauma. Now how about toxins? Do you know what the biggest toxin that we in our society actually deal with?
Drugs.
Drugs, exactly. It's a drug. Drugs' jobs are to inhibit or stimulate something. It's real simple. But if we put it in, is it allowing us to heal properly? We'll do a real simple one. Painkillers. We put in a painkiller and it stops us from feeling pain. How does that happen? It actually, exactly, it actually stops the communication to the brain. It stops the ability for the nerve to communicate. And by doing that, we can't feel properly. So if we can't feel something properly, how are we going to adapt? Because the whole body, the nerve system runs everything. The job of the nerve system is to determine good information in, information out. Bad information in, good information out. It's to determine that. Yes, James?
Does that hold true for alcohol?
Alcohol is a toxin, yes. It's a depressant, it will lower a lot of people. So if you have a lot of people that have ADD, or not ADD, I mean ADHD, and they're in hyper beta state, which means they're hyper aroused all the time in energy of their brain, they crave alcohol because it suppresses them and allows them to feel normal, because it slows down the brain function. That's what alcohol does. And that's why you'll see certain personality types be addicted to certain substances. Certain families are alcoholics because they all have ADHD tendencies. Certain families are more towards stimulants because they have ADD tendencies. And that's why you'll see certain things in certain families, because if you're a high functioning person where you go, you're gonna crave alcohol, because that's a way to suppress yourself. If you're somebody who's harder to get things going, or you gotta move a lot to get things going, you're gonna crave more of the stimulant. So that those are people more the cocaines and things like that, like pushers, or Ritalin, things like that, and that's how that affects the brain, is actually speeds it up and puts it more into a beta function. But all of these things are gonna lead to a structural change in your body because you're changing the neurology. How the brain communicates determines how the body shows up. So if you come in crooked, that tells me you have a crooked brain, simplistically. One side's functioning more than the other, and your body's not able to adapt. Now the thing is, your perception of the world is determined by your ability to see the world. So if you're seeing the world crooked, how are you gonna be able to react to the world? You're gonna react crooked, right? You're gonna react weird. It's not gonna be right on point. And we see this with a lot of people. I'll see a lot of people, and their first couple weeks when they come in, they're angry. They're angry at everything. And as we take care of them and adjust them and put proper stimuli into the brain to cause potentiation, which means more nerve growth, we see their brains start to balance and they start seeing the world differently. A simple example of this is I have a really nice lady. She's in her 80s, and she was the meanest SOB coming in this office. She was just angry all the time, just always going. And I've always been taught that when we look at them, we got to look at them through God's eyes. We got to look at them through the eyes of somebody who loves them and see what's really going on. Why is she angry? Well, she was angry because her neck was fused. She was in Germany during World War II, I believe, and she had her neck fused and one of her lungs taken out because they were just playing around with her. I don't know what they were doing. Yeah. And so she had this problem. And what had happened, because they had fused her neck, her body had literally got stuck. How your body perceives the world is how fluid your spine can actually move. Because if you're fluid in your spine, you can move easily. And if you can move easily, you can adapt easily. But the more rigid your spine is, or your spinal column, the more rigid your brain is because you can't adapt. So the sickest people you will ever meet are ones that cannot move and rotate. They're stuck. And their body is a reflection of their mental conductivity, or how their body's actually working, because they cannot adapt to the world. And so they cannot adapt to any questions. So what happened to her? Her neck was stuck. So what did we do? We came in and I found out that her skull was pressing on her brainstem. We adjusted that. The second bone in her neck was pushing on her brainstem. We adjusted that. She came back the next day crying and said, "You took my mean away. I've been mean for 40 years and you took it away." That's literally what she said to me. Now she's always comes in, asks for a hug, and is a very happy lady. And she's happy because she can adapt now. Whereas before she couldn't adapt, so she had problems. So you go, okay, well, what does this have to do? Well, if you have a rigid body because of thought, trauma, and toxin, can you adapt to sitting in a chair? No. You're gonna be out of sorts, you're always gonna be moving around, it's gonna be hard. So the reason why we need these curves is for our ability for us to adapt, because then we have leeway to move and allow the body to function and sway. So we want to think of it as like a reed in the wind, and if our body can sway like that, we're okay. We can adapt. But if we can't adapt, that's when the problems happen. So when we're in a chair, the major thing that I see with a lot of people is that they'll slouch. Now, if we're slouching, I'm taking the lumbar curve. I'm not looking at you. Lumbar curve out of our low back, so that's going to lead to disc herniations because we're putting too much stress on the front, on the disc itself. And then we're putting our head forward, and because our head's forward, that's going to cause our shoulders to get hurt. So what happens around 2, 3, 4 o'clock in the afternoon? Oh, my neck hurts, I'm so tired. That means we're sitting wrong. If we're sitting like this, we're sitting wrong. Low back gonna hurt, the mid back right here is gonna hurt, and a lot of these people, they get indigestion, heartburn, problems like that, because guess what this goes to? This area right here goes to the stomach, and it goes to this area right down here, it goes to the bowels and digestion. So we start getting heartburn, indigestion, we're not feeling good. But literally, if you change your posture, it'll change your life. Now, here's the interesting thing. That's just Ivy, it's okay. So here's the interesting thing. If you can allow your body to not be stressed by pulling all that stress on it, by literally just sitting up, and you're like, okay, that sounds nice. But in 20 minutes, I want to slouch again, because I'm just going to forget about it. The simplistic way to do this is to have a towel rolled up. Just having a towel rolled up will literally change your guys' life. And what I'll do, a towel, yeah. And you'll use it when you sit. So who wants to be a guinea pig?
I will be.
Okay. So I'm gonna put you sideways so everybody can see what's going on, okay, Mr. Brandywine?
Okay.
Is
I
okay?
didn't even know this.
Yeah. So have a seat for me and just sit naturally, don't try to show off or anything. Sit how you would sit at work, like that. Okay, do you guys see anything wrong with how she's sitting?
Butt's kind of forward.
Yeah, so she's leaning forward, right? And this is gonna cause her
Head's kicked forward.
head to go forward. So this is gonna cause problems in here. And it's actually gonna cause problems in her low back as well. So an interesting thing to do is this, lean forward for a sec, just put a towel behind her and lean back. And you just notice how her head straightens up? And her low back has that curve in it. This is forcing, just by putting it in the upper back, so right where your wing bones or your scapulas are, you put it there and it forces you proprioceptively to feel where your back is and put your chest out. When you push your chest out, your head can't go forward. So this is why
So
a
that feels
lot
like
of,
I'm going like this.
yeah, feels like you're gonna look down.
What,
Mhm.
the towel?
No.
If you try to put your head forward.
Yeah,
If I try to keep my head where it was before you put the towel back there, it's, I feel like I'm like,
exactly. So
so I have to like, oh, I can look up now.
put your head up. So now keep looking straight and we'll take it away and then we'll see how she changed. See how her head goes forward again? Now, that's trauma to the spine. That's literally trauma because we're sitting there like this for 15, let's not say 15, let's say 6 hours a day. I wish it was that's so short, right? Maybe 15 hours a day, and we're literally causing degeneration in that lower neck. And then what happens? Oh my gosh, my hand goes numb. Oh my gosh, I have carpal tunnel. No, you don't have carpal tunnel. You have pinched nerves in your neck because you're pushing it forward so much and you have inflammation of the discs. Carpal tunnel, 95% of the time starts right here in the neck. And then you got 2.5% of the time, it starts coming down in here, and it's literally almost nothing of it actually in the carpal tunnel itself. It's really hard on you because carpal tunnel surgery, they actually cut the tendon, and it's supposed to cover like this, and the tendons are supposed to go here, and it's a fascia, and they cut it and open it up. Now, if you cut anything, what forms so you can protect yourself?
Scar tissue.
So you think more scar tissue in a confined space is gonna make it better? That's why a lot of the surgeries don't work. It's just
Trauma.
simple. It's just simple physics or simple biomechanics. If you change a space and make it smaller, it's not gonna work as well for the movement of those areas. So when we look at this, the simplest thing for you guys to do is just get a towel, sit up for me, Ms. Brandywine, put it back, and that will force you to sit up straight if you don't have the proper ergonomical chairs, and those chairs are expensive, so this is a lot cheaper. A lot cheaper. Just roll up a towel, sit there, and it'll pull your chest forward. The other thing that you can do, and a lot of people talk about this, is rhomboid exercises. So these are exercises to pull your shoulders back. Now-
Rhomboid or rhombus?
Rhomboid. Rhomboid. It's this muscle right in here. So if you want to see if your rhomboids are strong enough, put your arm as close as you can against your body, then have your partner try to pull that one away. And if they can pull it away from you,
You're pretty good.
if they can pull it out, okay?
I mean, it's my left side.
Good, that one's good.
No.
If they can pull it out,
Okay.
we're good. So if you can pull that away, it means that rhomboid is weak and it needs to be trained. Because what happens is, then your body doesn't pull those wing bones or those scapulas back, and it doesn't keep you erect in the right posture. And if you're not erect in that right posture, guess what else suffers? We can't breathe properly because we're compressing our lungs. And then the other thing that happens is, we're going forward, so we're actually putting stress, so we pull our shoulders up, and then we stimulate the sympathetic chain right in here, and it puts us into anxiety. Now, do we want decreased oxygen, anxiety, and stress at work?
No.
Nobody wants that, but let's sit like that all day and see what happens. Does that make sense? And that's why by the end of the day, I'm all stressed out. I got no oxygen because I can't breathe. I'm all stressed out because I got cortisone, adrenaline, and insulin just pumping through my body, and subconsciously I think somebody's gonna attack me. That's what's happening. So literally, changing our posture changes our physiology. It's really simple. And everybody knows this, because what happens? If somebody walks into the room like this, are they happy? We all know they're sad, but if somebody walks in like this, we know they're happy. And that's because we all know subconsciously that how our posture is determines how we feel. It literally changes the physiology of our body. It allows dopamine to be released if we're in upright posture. It allows more oxygen to go into the brain. So what happens? If we have more oxygen, are we going to think less or better?
Better.
We're going to think better, right? And we're going to change our lives. So the key is to change your posture. Us as neurological based chiropractors, we want to change your posture. Yes,
What about, I stand most of the day at work.
that's good. I stand all day.
Okay.
So the goal for somebody who stands is to make sure that you have the right arch in your foot.
Okay.
Because the foot is the first place that attaches to the ground, and then you gotta see how are your knees. If you stand all day, we do not wanna lock our knees. If we lock our knees, what's going on is it will actually start causing degeneration of that joint, because we're locking it in place instead of relaxing. So the first thing they teach you when you're working out is never lock your knees when you go into a full leg extension, because you'll hurt yourself, because you're actually putting stress on the joint. As long as your knees are bent a little, you'll do okay. Another thing is like martial arts, they always teach you to have your knees bent a little so they can't get you, right? And that's because your muscles are taking the force.
How do you know if you have the right arch?
How do you determine it?
You'll feel it if you don't. Like your knees will start hurting.
Yeah, your knees will hurt, your low back will hurt,
hurt.
everything hurts, yeah. But that's all a byproduct of improper nerve flow to your feet, and the intertarsal muscles or the muscles in your feet aren't working right. And if they're not working right, then you have a flat foot. And then what it'll do is having a flat foot will cause literally your whole foot to internally rotate. So your talus internally rotates. And then your tibia will externally rotate.
That's what happens.
And then your femur will internally rotate. And guess what people get? Ankle, knee, and hip issues because they're not allowing the muscles to do the job they're supposed to do. Does that make sense? Now another thing, just on a side note, how she actually is with her feet, we'd actually want her to raise them up a little so we don't put stress on the hip flexors. So we'd want her leg to actually be up at a 90-90. So we got a 90 here and a 90 here. So a lot of people have boxes that they put under just so your foot relaxes, because what will happen is it'll get tight here, so you want to lean forward more. So as long as you can keep that leg at a 90-90, you'll be relaxed and you can work all day long, and then those hip flexors don't bug you too much. But the key, another thing that you guys want to do to make sure that you're okay is you want to move. If you don't move, it'll cause problems. So I recommend to all my patients, the first thing they want to do is make sure that if you're looking forward for a while, after 20 minutes, lean back for a minute. Do an opposite to what's bugging you. If you're going forward all day, do something backwards. And that's what we do. Most of us go forward all day. All day, all day, all day. So we get tight pecs. We get tight hip flexors. And these are what lead to upper cross and lower cross syndrome, which means you get carpal tunnel, you get shoulder problems, you get neck problems. It's because we're in a position we're not designed to be in, which is sitting. Sitting actually puts 150% the stress of standing on your low back. So there's more stress on your low back by sitting than there is standing. It's very hard on you. And that's why a lot of people, like forward-thinking companies, what they do is they have standing desks now, because they know you're more productive when you stand. You have less stress and strain on your body when you stand. And you can breathe more. You don't get depressed, and you don't have all these things. They don't all add up, because it literally changes your physiology when you're standing compared to hunching over.
I walked through this office the other day, and there was literally like 50 desks with everybody working, and there was a couple people with the bouncy balls, and there was a couple standing desks, and then most of them had, I don't know what to call it, but this thing to hold their computer screens up so
Yes.
it was level with their
Yes.
eyes,
That's
I was like,
ergonomically
wow.
correct. Because what are you gonna do? If you're looking straight or a little bit up, your neck muscles are gonna work properly. And you're not gonna lean forward, you're gonna be straight. So that's gonna help with that. if your legs are up or you're sitting properly, it's gonna have those hip flexors not hurt. And it's gonna allow you to breathe properly, and then you'll have more oxygen and you'll feel better. And we'll know that posture is right. So you can change your life by just literally changing how you stand. If you are in a bad place and you're not having a good day, just stand with your chest out and just take in 3 or 4 big deep breaths, and it will change your physiology. It will take you quicker out of that stress mode than going forward. Because when you go forward, you start stimulating the sympathetic chain, and that puts you in stress mode, and that takes your body into defense, and then you won't work right and you won't think right. And the hardest thing is if you're in defense mode, your frontal cortex actually stops working properly. You stop thinking correctly. So if you're sitting at a desk like this, you're gonna make yourself stupider. Literally. It takes the blood away because you start getting into defense mode, because you start stimulating that sympathetic chain, and that physiology leads to defense. You guys have any questions for me? No? So some keys, when we do sit, we want our legs and hip at 90-90. And we want to find a way to keep our back erect so that our chest comes out, so that when we're typing, we're like this. Because that's comfortable. The other thing is every 20 minutes, make sure you lean back or stand up to walk around to get the blood going, because the blood will actually pool in your legs. What they taught us in school is if somebody comes in burning calf pain, think of a deep vein thrombosis. What that means is it clotted in your veins. So as we can keep our calves moving, it'll pump the fluid. Some muscle pump, it contracts and it pushes the fluid back to the brain, and then we'll oxygenate it and we'll work better because it'll pool. Yes?
Can that cause spider veins?
Yes, that's actually how you can start getting them.
Oh, great.
It's, what happens is the venous valves stop working as well, and you break 1 and it breaks 2 and 3, and then they start pumping up. So yes, so make sure you're doing, the calf raises, real easy stuff, or just sit at your desk and do calf raises, and that will pump the fluid back to your brain. So we got a 90-90, keeping our back erect. Easiest thing is a towel. You can get those low back cushions, but they're not as productive as a towel right behind that mid back, because that makes you do it naturally, and then you train your brain to fire properly. And then being able to stand up, every half an hour to an hour, just gets the blood circulating. Maybe go for a quick walk to the water heater and come, or water cooler and come back. Water heater.
Depends how much money you have.
Yeah. And with those simple tasks, your productivity will go up. Your ability to deal with stress will go up, and you'll have a better day because increased oxygen flow, increased endorphins to your body will allow your body to heal. So just take those 3 simple steps, the feet up, 90-90, so the knee and the hip, and making sure that your chest is forward and not, or backwards and not forwards, because when you go forwards, that causes a lot of arm and hand issues, carpal tunnel and things like that. These simple tasks will probably change 90% of the people that hear this information and allow them to sit properly and not have any issues. Any questions, guys? Excellent. Well, thank you for listening. And all I ask is, if you know somebody and you could radically change their life, would you do it? I would, right? So just think of a friend or family member and say, you know what, maybe you should listen to this talk. Maybe you should think a little differently. And don't try to radically change somebody's life, like hit them over the head with a frying pan. Just do it slowly. Like how my mom taught me, if you want to cook a frog, you don't put them in a hot pan. You gradually turn it up, and because they're cold-blooded, eventually it gets really warm and they don't even notice the problem. That's how problems happen in our body. They slowly get really, 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 really bad, and eventually it breaks through. So why don't we stop them before they get worse? Thank you guys so much, and we'll get you guys adjusted.
Thank you.